All right, good morning, everyone. You guys ready? All right. My name is Scott Decker. I'm a public health analyst with DHQP. I work on NHSN. A lot of you probably know me by my email handle. If you send questions to the NHSN box about locations or annual surveys, they're more than likely that they'll come to me. But for this morning's presentation, I'm going to, veer away from those topics for the most part and focus mostly on just giving you guys an introduction of NHSN analysis. And really this morning, I know there's a wide breadth and experience in terms of infection control and more specifically NHSN users here. So my whole goal for this morning, I think, is just to provide a really good foundation of all the analytic options and functions that you will see throughout this week through specific HAI analytic presentations that my colleagues will be presenting today throughout the week. So I want to give you guys an opportunity to see all the screens, see all the different choices and options and folders and reports that you can run. I'll show some examples of what they'll look like, how to manipulate or modify those reports a little bit. But I think the meat and how to use those reports for your specific analytic purposes for specific HAIs, my colleagues are going to cover that throughout the week. So if you're a new user, I think this is going to be extremely beneficial for you. So if you're a more seasoned and veteran NHSN user, I believe I've sprinkled some things in there that you may find interesting or useful they have not used in the past. So we'll see where it takes us. Just a quick message about the data for this presentation. It's been created in a testing environment, and it's for training purposes only. So the information you're going to see today do not represent any actual data that's been submitted to NHSN by participating facilities. All right, before we get to those NHSN reports, we want to make sure that we prep our data and we have good quality data to analyze in NHSN. That starts with our data entry sources. So looking at the NHSN screen on the left-hand side, you'll notice the NHSN homepage and all these different options you have. So the main 4 areas that I've identified that you're going to input your data are going to be those events, procedure level data, summary level data. So this is your MDRO, your device-associated summary reports for patient days, line days, MDRO days, things of that matter. And finally, those surveys that are completed once a year. I'll go into a little bit today how those surveys can impact specifically your SIR and how those surveys are used for data analysis and what potentially you could be entering those surveys, how they can change or impact your SIRs. So if you click on any of those options, your events, your summaries, your surveys, you're going to be greeted with, more than likely 3 options: add, find, or incomplete. Add's pretty obvious, right? You're going to add new events, you're going to add procedures, add summary reports, add a survey. Find and incomplete. So those find options, this is, in lieu of maybe using some NHSN analytics. If you're just looking for a simple line listing of events or procedures or reporting plans, you can just enter very few details in terms of maybe event dates, or like a range of dates, a range of reporting plans, and find a listing of all those events, procedures, reporting plans within that given field range. So that's one way to use the find. And of course, incomplete. If you have incomplete summary reporting plans or incomplete data fields, looking for just selecting that option will provide you a line list or provide you an output of that. Annual surveys and data analysis. Like I mentioned, every year a new survey is entered into NHSN to reflect data from the prior calendar year. So currently we're, the deadline's passed, but just as a public service announcement, if you haven't completed your surveys, we're still taking them, so get them in as soon as possible. So those surveys are titled the 2018 Annual Survey, and again, that's representative of the full calendar year of 2018. And so what that does, those survey data, those survey years, will be used to risk adjust or to apply to your SIR calculations for the years of 2018 and 2019. Now, there may be some pause when I say, your 2018 survey is used for your 2019 data. That's because we have a business rule in place that, if the most recent survey for that specific year of data that you're using is not entered, it's going to use the most recent survey that's been entered in NHSN. So if, for example, you have not completed your 2018 survey, you're not only is your 2000 and the most recent survey you have completed is 2017. Your NHSN data is going to use the 2017 survey to risk adjust for your 2017, your 2018 and your 2019 data until you update your 2018 annual survey. And this is just a visual representation of, I think, how NHSN behind the scenes, but how the reports and analysis functionality works. Falling into this little tunnel here is, your event level data, the survey data, your summary data, your procedures. These are all the things that you control and you contribute to NHSN into the system. And that output, of course, is your desired reports, whether you're looking at rate tables, your SIRs, your CMS reports, all those things that we create behind the scenes to give you that information, or to use your data to give you something meaningful with, is your output. Okay. So monthly reporting plans. This is, I think, where a good starting point, I guess, in terms of data entry for NHSN and for required reporting should start. It's used by all NHSN facilities to inform CDC and our partners which patient safety modules will be used in a given month. So participating facilities must select the modules used, if any, and the events and procedures and/or locations that they're going to be monitored in plan. So this is our first indication when we actually ultimately send data maybe to CMS. This is what's being used to reference. This is what's being used to look at, to see, okay, there's data from these locations, from these required locations, or from these required procedures that need to be submitted to CMS. This is kind of the reference points. This is what's being used to identify what's being sent. Okay. To add our monthly reporting plan, again, we're going to go to that left-hand navigation bar in NHSN. You're going to get the options of add or find. If you want to add a reporting plan, you'll just select add. It's going to take you to this next screen. We're going to select a month and a year for your plan that you want to create. Now, for whatever reason, you do not have data for a specific month. There's no locations, there's no events, there's no procedures happening. Maybe there's a facility closes for renovations for whatever reasons. Sometimes this does happen. If there's nothing to report, you can simply select no NHSN patient safety modules followed this month. So that'll gray out all the options you have to report for the reporting plan. You'll save it and move on. However, if you do not have that option, you actually do have data to enter. You're greeted with these options. They're broken down into different HAIs. So we have the device associated modules, procedure, AUR, and MDRO. So based on the specific module you're looking at, there's going to be specific indicators that you want to select. So for device associated, obviously there's location levels that you want to create or that you want to add to your monthly reporting plan. For procedures, you're obviously looking for procedures. And additionally, for MDRO and AUR, you're looking at the location level. And from there, you can select, for device associated, if you want to follow CLABSI, VAE, CAUTI, CLIP, or what have you. This is just an example of what it looks like for procedure level module. If you want to follow knee procedures or knee prosthesis procedures for that particular month, and you want to select in and outpatient, just know that you have to select both in and out for that procedure for it, to register, for it to look as it's in plan for NHSN. If you're looking to add rows or add procedures, add locations, hit the add row button. You'll get another opportunity to get another drop down window to add additional or multiple locations, multiple procedures in NHSN. And finally, the other option you have there is copy from previous months. So whatever you have, you've created a ton of monthly reporting plans. Nothing's changed from the last month to this current month. You can simply select copy previous month, and it's going to transfer and roll over all those locations, all those procedures, and all those options, whether they're inpatient, outpatient, or your various HAIs that you selected for those locations. I'm going to pull everywhere question here. I think we're still... Well, I think it's still up right now. I think we're at 0. So looks like you guys are ahead of me. So if you have an opportunity to participate in the poll ever, we really encourage it. Just text NHSN to 22333. Looks like it's working. We're getting the answers in. So the question is, can you add inactive locations to your monthly reporting plan? I'll give you guys a minute to work through that. It's okay. The correct answer is true. And But the correct answer is true. I noticed a lot of you guys selected false. You can always add inactive locations to your monthly reporting plans, or you can have them included on your monthly reporting plans. And just to know that if you have inactive locations that have data that's been uploaded, the data that you want to have submitted to, say CMS, for example, in a required location type, it will be sent there. So if you have an inactive location, you remove it from your monthly reporting plan for a given month, that data would not be sent. So it's imperative that if there are locations that you make inactive because they're no longer active, but you have previous or past location data that you want to send to CMS, it needs to be included in that monthly reporting plan. So if you want to make those edits, you can go back and add those inactive locations to those monthly reporting plans, or if they're there, keep them. But however, if you have an active location, there is no data coming from them, but there's no data that month, you need to remove it by clicking that little trash can icon on the left-hand side. All right, alerts. So alerts, monthly reporting plans and alerts kind of go hand in hand. The monthly reporting plans are what help generate alerts. So if you have off-plan data, so there's data you're entering in NHSN that's off-plan, alerts will not be generated. And so, as many of you know, this is one of the first things that greet you when you log into NHSN, and they provide you information on incomplete or missing in-plan data that you may need to correct or add before moving forward with your analysis. So clicking on one of those like window panes or one of those alert boxes is going to bring you to this page here, and it's going to give you an individual line list of those specific alerts or those specific missing or incomplete data that you need to correct in order for those alerts to be cleared. So in order for one specific alert to be cleared, so if you want to remove one of those boxes, so for example, if you have 132 incomplete events, you need to complete complete all 132 of those events for that box to be cleared. Resolving alerts. So if you click on one of those items from this line list here, it's going to bring you to a page like this. So if there is an incomplete summary data form, you'll notice here that there's an open box here for CLABSI for report no events. And so when you completed your summary reporting plan in the first case, you did not select this this box, maybe because you thought there was an event, or there could be an event still for the summary report that wasn't reported yet. But you've gone back and you've verified that there wasn't an event to report for that particular month for CLABSI or county. You can select it here, and that will clear that alert. However, if you do know that you have an event, you'd obviously have to move backwards and add that event to NHSN. And that's another way too for this incomplete summary record to be resolved and to be cleared. So once you've added all your monthly reporting plans, you've entered all your patient level data, you've made all the changes you'd like, and you're ready to step into the report section of NHSN and do your some analysis and see what's going on with your data. The last thing we ask you to do is generate those data sets. And so it's pretty simple. Just going to generate new data sets, and all that new information that you entered in your last session before you previously generated your data is going to be uploaded. So without doing that, when you run NHSN reports or analysis, no data will be used that you just entered without generating data sets. And don't forget to check the box to include all years of data. So if you want to include all your data that you've added throughout the years, make sure to check that box. So once we generate data sets, we're now ready to navigate data analysis and dig into our reports and see what our data looks like, what it's telling us potentially. So you can click on reports underneath the analysis tabs on the left-hand side of NHSN. And then I look at here, this is the first set of folders that greets you in NHSN analysis. And the ones I've highlighted here are ones that are, I think, most commonly used in NHSN for different HAI modules or your CMS reports. I don't see Rashad here. He might argue that TAP reports are used a lot too. They are. So he might be upset I didn't include them. But TAP reports are also available too. We'll learn more about that later today. So if you collapse one of those folders, for example, you just look at device associated, there's going to be subfolders and multiple reports you can run for specific device associated data. You can look at bar charts, line listing of events, frequency tables, rate charts. You can look at SIR reports that aren't specific to those CMS requirements. So if you have locations that are not CMS required, but you want to look at your SIRs, this is the place to go for that. Again, this is, I think, just more folders that provide specific analysis for your reportable HAIs. Again, if you want to look at specific SIRs that aren't submitted to CMS, underneath all these folders is a good place to start. This is just a CLABSI folder, what it looks like for lab ID reporting. So all the different lab ID events that you can look at within the MDRO module are available here. And finally here, those CMS reports. This folder provides default reports that mirror CMS reporting requirements. When I say default reports, I mean, I'll demonstrate later that a lot of these reports in these other folders and the advanced folders, you can make specific modifications to. The CMS reports folder are extremely limited in what you can modify, and that's to have have complete compliance or complete compliance to CMS requirements that you're going to be submitting, and to mirror those reports that CMS is running that you're going to see on hospital compare, so you can look at your data and make a really quick compare to validate what's been reported. So we do limit what type of data is can be viewed and looked at for those reports. Also, we have baseline set one reports. So we did a lot of education over the last few years about the rebaseline that we did in 2015. If your facility participated in NHSN prior to 2015 or 2016 and have data that use the old risk adjustment modules of NHSN, you want to look at those reports. The baseline one set reports is a good place to do that. But again, just be mindful that anything beyond 2016 will not be found in this report. You have to run just the general those general HI module reports that I previewed in those previous slides. So that's always there. Finally, there's NHSN analysis reports, the advanced folder. This is the folder that I think a lot of analysts on our team look to troubleshoot data that we get from users or questions we get from users. There's a lot of modifications. There's a lot of really cool things you can do to manipulate your data and view specific timeframes and really parse out the data that you want to look at. So I think this folder offers a lot of opportunity to look at. You have summer level data. You can look at monthly reporting plans in a line listing environment rather than going into individual reporting plans from the NHSN navigation page. So there's a lot of interesting things you can do with this folder, which I'll preview later. So when you actually want to run a report, when you actually want to look at some of these reports at NHSN, there's three options typically when you select a report you want to run or you want to look at. One, you can just simply run a report, and that's going to provide an output of all the available data for an HAI or for CMS report that you select here. So you're not doing any kind of modification. Whatever you've put into NHSN, you regenerated your data sets, it's going to get spit out when you run a report. All right. Now, if you want to look at a specific time frame, if you want to look at specific locations, if you want to change your data just to look at a cross section of it, modify report is the place to go, where you can select specific variables, sort your data for different time frames. This is a good way to do that. And finally, export your data set. So this allows you to transfer your data from several different file types, Excel, just text documents, SAS files. That's all available. So I'll go into a demonstration of how you can export. There's two different export options. If you export from this screen, if you export your data from this screen, again, just like run report, it's going to pull all of the data that you've entered into NHSN for that specific measure into that export. When you start modifying your data, you can get a more finite, you can get a more specific export of what you've modified in your report. So I'll explain how to do that in a little bit later. But there is two options when you look at NHSN analysis to export your data, and they could give you two very different types of data sets when you're done with it. So I've chosen just to modify my analysis report. So this, if you do select modify in lieu of run, this is the first screen you're going to get. There's a couple things I want to point out here. We have a show descriptive variable name. So all those really kind of confusing or cumbersome variable names that you'll see in those stock reports that you run at HSN, if you just simply select show descriptive variable names, you'll have a more clear and more, I think, digestible description of what those variables, what those columns and rows mean. And I'll show you a compare and contrast of the two different options. So additionally, on this screen, it tells you what types of data sets you're using here. And also tells you what date your data set was generated on. So again, this is kind of your final warning just to check that here. So if you know you've updated data or added more data since that data set generation, you're gonna have to move backwards and regenerate data before you come back to review the reports. Modify analysis reports. This is just quickly if you want to change a title. So there's just a default title that greets you when you open these reports. If you want to change your title, you're more than welcome to do that. And I'll show you how that could be useful in terms of organizing or saving custom reports. But just know that you can always modify and change that title that you first see on the screen. And finally, here there's a format option too. The basic or default option for format is HTML, but there's PDF, XLS, and RTF files that you can choose and opt for in terms of outputting your data. Time period. So this allows for a selection of a specific time period for your report. You can select a date variable from the date variable drop-down menu and specify the beginning and ending for your desired time period. So if you leave these, again, if you leave these two fields blank, you're going to get all the data from that time. All the data you've entered in NHSN is going to be spit out. So if you're here to modify, you're here to look at a specific interval of time, I suggest selecting a specific date variable, whether it's a year, month, or quarter, or span of those things. This is the place to do that. So for my example, I just want to look at the full year of 2018. So I'm looking at summary YR to indicate year from 2018 and ending in 2018. So this will give me all that data that's been entered for that calendar year. I want to move over. The next option I'm going to get is our filters. Each addition of a group and a rule will allow you to specify values. Again, so after you select a variable to filter, click on the empty box with the drop-down arrow to select the operator. So the things like equal to, it's all going to depend what you're looking at. If you're looking at specific dates, or if you're looking at a location type, that's going to kind of dictate what kind of operators you want to use for your filters. And I'll show you an example in a minute here. So again, this is kind of a good way to remember this. So a group will help you generate a table with a select number of rules and conditions set. And so a rule is a set of conditions that will restrict what type of data is populated in that group. So that group is, each group you have is, you're kind of creating your own table. And within that table, those specific rules that you get. So for example, I'm using location type. In that table, you're only going to have location types that are equal to CC. And what that means is, for this report, I'm looking at for CLABSI data for SIRs for 2018. I just want to look at data that's coming from all active critical care locations mapped to the facility during 2018. So I got one group and one rule in my filter. And finally, display options is your final thing to select your modify. Again, this is creating more tables. So you selected a time period of what you want to look at your data at with, and if you want to group your data. So say you're looking at data for 2018 for the full calendar year, but you want it broken up into quarters when you look at your output. So you can simply select by group by YH to indicate half a year. So you're going to get two tables, one for the first 6 months and one for the second 6 months of the year. You can select YM, that's going to give you a table for each month. For 2018, YQ, it's a quarter, so you're going to get 4 tables, one for each quarter. And then if you leave it at summary year or cumulative, for this example, you're going to have just one table for 2018. Once you're done modifying everything, you can now run, and this is your output. And again, so you're going to see all those modifications you made in that previous screen are all going to be displayed here. So you can see that your location type equals CC. So this just includes those critical care options. And it's just including that summary year for 2018. You also will notice too that there's certain rows here that are highlighted in yellow. That's to indicate that those NHSN analytics, our risk adjustment models were applied, and that's NHSN calculations. That's nothing that you inputted or incorporated specifically. You didn't do anything to generate that calculation except put your data in. And then that's, like I said, that's the NHSN analysis in the back end is creating those number of predicteds, your SIRs, your p-values, all that data, in fact, all those data that are not in yellow, so your infection count, your number of CL days, those are data that you are responsible for inputting. That's stuff that you've put in your number of events, your number of CL days, and those summary reporting plans. That's coming from the NHSN user side. All right, interpreting the output. This is what your report looks like when you show descriptive variable. Oh yeah, I wanted to show you that. So this looks like, so when I did not select, a few slides ago, I showed you the option to select show descriptive variable names. This is not showing those variable names. These are just the default names that we created to organize these data sets. So if you want something more clear, if you want to know what this means, or you want to show someone else that doesn't want to interpret what numpred means, that's not familiar with these types of reports, you can simply, by selecting that descriptive variable names, you'll see a more cleaner and more clear breakdown or description of what these variables all mean. All right, interpreting our output. So again, like I said, those numbers not in yellow are variables or values that we're responsible for. So we identified one event from 2018 from these locations from critical care. You'll see that with the events row. And the SIR is calculated with one event over the number of predicted. So the number of predicted is something that NHSN calculates using your survey, using your number of central line days, number of patient days you add in your summary record plans. All those risk adjustment models are used. And for this specific example, we predicted that 2.61 infections were to occur during this month from these facilities, or for this calendar year from this facility. And so finally, the SIR with one event over the number of predicted gave us an SIR of 0.0374. So this signifies that during this time period, our facility identified less CLABSI events than predicted. And then again, we'll repeat this throughout the week, that SIRs will only be calculated if the number of predicted infections is greater than or equal to 1. The p-value. So this is also on the SIR reports. It's a statistical measure that tells you the observed number of infections is significantly different from what was predicted. So by our definitions of how we use the p-value, anything less than 0.05 indicates that the number of observed CLABSIs is statistically significant different from the number of predicted. So you can see in this example, our p-value is 0.3232. So we're saying that there is no significant difference in 2018 between the number of infections observed and the number of infections predicted, even though by just looking at it visually that we have less events than we expected to have. And finally, the confidence interval. So this is the 95% confidence interval is kind of the range of values in which the true SIR is thought to lie. Again, so this is kind of another way to look to see if your information or if your data is statistically significant. So if we have a confidence interval that has a lower bound that is less than or equal to 1 and an upper bound that is greater than or equal to 1, then the SIR is not significant. So again, we're seeing that here in our analysis for the 2018 data for CLABSI. All right, I've got another poll everywhere question. The question is, what interval time is not available for the date variable selection when you modify a CMS report? You guys have a few minutes to think about that. All right, I think we're set on this one. The answer is B. Looks like everyone was pretty clear with that. Again, you can always select half year. You can look at months. You can look at quarters. You're looking at years, but we don't have weeks available. All right, modifying your analysis report, saving your report. So say you spent all this time modifying your report. You really went in there. You got a lot of different groups, a lot of different filters going on. You like your report. It looks good. You want to look at it again, and you don't want to go through the trouble of setting it up and creating it all over. You can just simply select save to save that report in your NHSN folders. If you select save, again, you're going to get an opportunity to name your report. So that title change or that name change that you may have changed or created at the beginning of the modify report is going to be here. You have another opportunity to edit or change that here. So anything that's specific that you want to identify for this report that'll be helpful for you to access it in the future would be recommended. So I just simply said this is my report, SIR, SIU, or the ICU for 2018 for my hospital. So then just simply select save. And once you do that, that custom reports folder is going to be created at the bottom of the folder you first accessed to generate and modify the report. So I found that I first used that SIR acute care hospitals for CLABSI data to modify and create this report, and I'm going to have to go back to this central line associated BSI folder to find my save custom reports, and they'll be at the bottom there. So you can continue to edit, modify, delete. You can export that data in the future if you like. It'll be there for you. And again, like I said, export, another opportunity to export your data. This is really for exporting your modified data that you just had here. Like I said, if you export your data at the beginning, before you, when you get the option of running, modify, and export, if you export just then, you're going to get everything. And maybe you just want that 2018 data exported to some kind of file type. So Again, this kind of just explains the difference here. You have the option of exporting the entire analysis data set. You can see on that bottom photo there. You can just select export entire analysis data set. That'll give you everything, but if you just want that data that you just modified, select that bottom option. And again, there's different file types. I selected to export it as an Excel file, and you'll see that I have my 2018 data from this location type that's been spit out into an Excel file. All right, so we've modified our data, we've looked at our data, maybe we see something wrong or something that looks kind of off about it. It's another opportunity for us to do, data quality checks, validation. So that's kind of the next piece I want to talk about right now. So we just looked at our SIRs here. We may have seen a number of predicted, or maybe a number of events that was either low or too high than what we were expected, or what we found to be normal from past analysis. And so you're asking, what can impact that? Why is my SIR? Why is the number predicted so high or so low? And it could be, a laundry list of things, but these are kind of the common things you should be asking or thinking about. Specifically for each of these data selection screens, monthly reporting plans, you can ask, are these monthly reporting plans complete? Are all my active locations available on those monthly plans? Are all the appropriate procedures selected for inpatient, outpatient? For annual surveys, are the number of beds updated from the previous survey year? Has my medical school affiliation changed from one year to the next? That's sometimes the main culprit of why our SIRs could change from year to year. And also, too, do we clear all those alerts that we saw at the beginning when we logged into NHSN? Are those still there? So again, like I mentioned earlier on in the presentation, I think the advanced folder is a place where us as analysts with NHSN like to go in terms of troubleshooting facility data or facility questions. I think it just offers a really large menu of options when looking at summary level data or plan data that looking at an individual level, looking at every single reporting plan, every single summary record on an individual basis is it takes a lot of time for us. So we opt to use the advanced folder to look at those reports. So again, here you'll see the different options. You can look at patient level data, event level data. You can look at your denominator forms, your plan data. It's going to give you all your monthly reporting plans you've entered, and it will include all the information that you added and had available on each month report, facility level data, and data quality. All right, so within the facility level data, that's where you're going to find your annual survey data set. So this is a good tool for routine data quality checks. Like I said, there's a lot of information from the annual surveys that are applied to different SIRs. And this is a really good way of looking at a quick snapshot of how your survey has changed and what kind of data you've put into your survey over the past years that could be the change for your new SIR that you're looking at. So again, this is the modified screen again. I've selected variables that are really only germane to the creation of the SIR. There's a ton of variables, as I'm sure if you fill out the annual survey, there's a lot of questions. So what I have on the right-hand side does not encompass everything on the survey, but if you want to look at responses from the full survey, you're more than welcome to do that by pulling all those display values or display variables over to your right-hand side, and you'll have the other information. But for the sake of time and so we can just quickly read it, I just selected the information that's used for risk adjustment purposes on the right-hand side. So when I run my report, I can see 2015 and 2017 survey data here. I can look at how the number of beds have changed from year to year, the number of patient days. I can also see the medical school affiliation and if that's changed. And I've seen here in 2015 and 2017, there is a change. It's gone from major to undergraduate to no medical school affiliation. So that is a good chance that your SIR could change within those years because of that. And so that's an opportunity for you to, I guess, to investigate to see, are we meeting the current definitions for medical school affiliation? Do we have it captured here correctly? Is that right? And if not, is that what's causing the problem, or not the problem, but the discrepancy in my SIR? Again, another option in the advanced folder is the data quality folder. This is, a lot of information that maybe exclusion criteria for SSI data that would be captured here in a quick line list. We have the CDI test method history. So just looking at your CDI test methods that you've reported on the quarterly level for previous years will be found here. And so this is another easy option if you want to get your feet wet with data quality. We have I think some common issues that facilities have found in the past, and just try to replicate a report that includes that, so you can look at it quickly. So we're going to do one more scenario, then we're going to, I think, move to questions. But the scenario we want to look at to use the advanced folder is you want to confirm that colo and HIST inpatient and outpatient procedures were selected for 2018 Q1 data on your monthly reporting plans. So there's two ways you can check and do this. Like I said, you can take what I think this is the slower route, which is looking at each individual monthly reporting plan, going back and forth to make sure that you've captured everything you wanted on it. That can be time consuming. Or you can use the advanced folder, and you can use some of the tools you've been equipped with during this training to look at your plan level data report to see what was included in all your plans, and just in one simple table. So again, here, again, the time period is an option for this report. I'm selecting just look at the beginning and ending of, I just want to look at quarter one, so I'm just selecting the month of January 2018, and I want to end at March 2018. So that's just going to include that first quarter's worth of data to see what's on there. My procedure codes for my filters, I want to add procedure codes for HIST. Looks like I forgot colo, but I want to include HIST and colo to see what those are on monthly reporting plans for those full 3 months. Okay, then I want to pull my selected variables. I want to look at, I want to look at my org ID, my facility ID. I want those procedure codes up there. I want to look at the create date and the modified date. And I'll explain what those variables can do and what those can help you understand about your data in a moment. I want to look at the output. So this is the output after I made those modifications to the time and those filters. This is what I'm seeing on my monthly reporting plan output for 2018 quarter one. So there's a couple things I see. I should expect, because I'm looking for both inpatient and outpatient data, there should be 2 colos and 2 HISTs on this table for each month. So what I'm seeing here for January, I'm looking at, I only see 1 colo and 2 HISTs. So the 2 HISTs looks right. It looks like I have an inpatient and outpatient underneath setting. So I've got it included there, but I only see 1 inpatient colo procedure for the monthly reporting plan for January, whereas when I look at February, I see I have 2 colos and 2 HISTs, so that's right. So it looks like I'm missing a colo outpatient in my plan for January. So that's something I need to change. Additionally, there's a whole month missing. I don't see March here. So I know that I'm missing a monthly reporting plan for March 2018. So before I regenerate data sets and look at my analysis again, I want to make sure I go back and add those procedures to my March 2018 plan. All right, I talked about the create date and modified date. So the create date is, what the create date value for the advanced folder indicates what date that that monthly reporting plan was created in NHSN. So the first time it was uploaded, the first time everything was saved to it is going to be captured and timestamped here, and that won't change, okay? You can also see the user ID next to it for data entry. So this is going to tell you which user created that plan, which user first created that data that you're seeing on this report. It requires you to know your data entry ID for all your personnel, all the individuals that use NHSN facility, but it is unique to whoever includes that data. So obviously the last modified date is when if that data was ever changed or modified. So if your monthly reporting plan was updated, something was deleted or removed, that's going to be captured and timestamped there. And so this is a field that can change if your plan or if the data you're looking at continuously gets changed. And so the last time it was modified is different from my create date. So that may be the reason why something is missing or something looks different or looks off about my data. And so I could then look at who the modified user ID was. I can go to them and ask them, is there a reason why you don't have March monthly reporting loaded to NHSN? There probably isn't a good reason, so they're going to want to go back and add it. So that's a good indication of where to investigate and where to maybe find some answers about your data. And just generally, just data quality within NHSN, I really advocate the use of the guide to the SIR that we're going to, I think, see throughout this week to identify important factors in your facility's data that can impact your SIRs. Work with staff to develop a list of routine checks that you can perform on a monthly, quarterly, and/or annual basis. And then I think also, too, just to modify and save NHSN reports in NHSN to help expedite and organize your processes. So if you create data quality checks using NHSN reports, and you save those reports in NHSN, the next time you go back and do it, it's a much more faster and cleaner process. But those are all things that I think we suggest doing in terms of data quality. Fortunately, my colleague, Jennifer Watkins, is going to talk more about data validation next. So please pay attention to that. She'll have more tools and more tips, I think, with cleaning and analyzing and validating your data to make sure it's of the highest quality. So with that, I have a couple additional resources that I used, that I helped use to create some of these reports today that you may find helpful. And with that, I think I'm done. I'm all wrapped up. So I have some time for questions. It's like I've got about 10, 15 minutes. So if anyone has any questions they'd like to ask me right now, I can feel free to answer them. And if not, I'll be here throughout the week to fill any questions. And if you have location or survey questions, I love talking about both of those topics. And I would love to do that in a one-on-one conversation with you. Yes.
Back for SSIs in patients that were classified as dirty or contaminated. And where do I look to run that list of patients? So I know it must exist. You have your denominator data, and you've put all this information in.
Right.
How do I run a report for, let's say, for 2018, the patients who had colosurgery, and they're in like the entire line list of the, with the ASA scores and the wound classifications? I figure it's got to be there somewhere.
It is there. And Rebecca, are you gonna cover all the different variables that are going to be included in SSI reports? I'm not intimately familiar with the SSI reports, but
okay.
There are all those variables are available in those SSI reports that you can pull in to look at those ASA scores and those procedure durations.
Right.
And you can pull those into those modify screens and view them and look at them.
Right. So I'm not actually looking at the SSI report per se, just the people who had an SSI who were dirty or contaminated.
Just procedure.
I'm just looking for the list of procedures.
Okay.
The patient list.
Yeah. Let me go back, because I think I have a screenshot of, within the advanced folder, there's an opportunity to look at just procedures. There's a procedure folder. I didn't collapse that folder. Let me go back. Here we go. So yeah, procedure level data there.
Okay, so it's under that.
All your procedures that you've entered in NHSN will be live. You can find them all there. They're not excluded.
Okay, so that's where I need to look. Okay,
that's where you go.
Just
yeah.
Thank you.
Yep.
I have a question about whether you have. So when you first log on, you see the missing,
the alerts, right?
Incomplete, alerts. Yeah. But you can't really tell from that if the data is relatively skewed. So for example, one denominator, let's say line days, for one unit for that month is 3, and it's usually 300.
Okay.
So you have to run one of those advanced reports to see that discrepancy, or is there some other way to do that?
Right. Yeah. So you're saying that wouldn't necessarily wouldn't be an alert. So if you've entered 3,
it's not an alert. That's the problem.
That's what we're really using the NHS analysis functions and use the advanced folder to find those discrepancies and find data entry errors. They're not going to be populated in those alerts for that specific example. You're going to have to run those specific line listings to look at, if you're looking at monthly reporting plans, you're going to have to go at the advanced folder here. If you go under that plan, or that summary level data, you can run and look at those months at a month-to-month basis to see, if everything is, mostly normal in terms of what you're reporting. To identify the 3 where it should be 300. That's the way to do that.
But you get it in a huge line listing, or is there some other way to display it so you can kind of pick it out? So in the past, I had a analytics person who would be able to actually extract the tables. Mm-hmm. And visually from the tables, you could see, if it had 1 digit or if it had 12 digits. Is that a better way to look at those types of discrepancies? And if it is, please explain to me how you run those tables. How do you extract those tables?
The tables, are you talking about Excel tables?
Right.
So again, it all really depends on how deep and how specific you get with your modifications. If you're looking at summary level data and you know there's a span of months that you want to look at. So I know looking at a giant line list of all the summary level data, it's a lot. So again, if you use those techniques I was talking about earlier about restricting it to those specific months or that specific calendar year that you're looking at, you then can export that data to Excel. So it will spit out to you what you'd see in NHSN on those NHSN reports, but it would be in Excel with just those months. And you can just simply select those variables that you're interested in looking at. So number of CL days, number of patient days, they would be there.
Okay. So then you can see that a little more easily.
Yeah, we can walk through it this week.
Please.
So I think we have a question from online that's been submitted. And I think Rebecca's gonna provide it to me.
So this question is from a critical access hospital user, and she would like to know, on the annual survey, it asks for annual admissions. Her question is specifically, is it just IP admissions or all admissions included on their reporting plans? So especially those from ABS and swing beds. So is it all admissions or specifically just IP admissions?
Inpatient.
Yes.
I mean, the question indicates that for that question on the annual survey, the question that she's asking is for a number of admissions, what should I include my total number of inpatient admissions or all admissions that are captured in your facility? So all inpatient locations that are located within your facility should be captured on total admissions for your annual survey.
And she would like to know the same for patient days.
The same thing applies. So all patient days that are captured within all inpatient locations throughout your facility should be captured and included on your annual survey. Okay. I don't see any more questions. Like I said, it's only Monday, so new ones come to you. Please find me. I've got the blue lanyard. More than happy to speak with you one-on-one. Thanks again for your time. Looks like we're going to have a short break.